Question coming in from Vicky. I am a breast cancer patient and had 5 rounds of chemotherapy that included paclitaxel. I have been having severe numbness, difficulty in buttoning my blouse, and tingling sensations in the legs and hands. Are there any medications or physiotherapy that may help me?
It's a very good question. It is very early on that you have already neuropathy. So you have something we call a grade 2 neuropathy. We grade the side effects from 1 to 5. So grade 1 is when it's a little bit, it's not interfering with the function. Grade 2, when it starts interfering with the function, which seems to be the issue here. This is the time when it's necessary to reduce the dose or hold the treatment until the side effect recovers. A lot of people do not want to stop treatment, but maybe dose reduction is important for you. But I will give you some little pearls how to help prevent it from getting worse so you can stay on your treatment. Some of our naturopaths can sometimes use vitamin B complex, vitamin B1, B6, and B12. Typically, they intervene in nerve function, and that can be a little bit helpful. That's in terms of supplements you can be taking. In terms of since you mentioned physiotherapy, the diabetics can use the TENS unit or something we call the rebuilder. That sometimes can help with neuropathy, can help reverse it and stop the progression on future treatments. So that's something the local physical therapy or any place that treats diabetics from neuropathy, there's an electrode that placed on the fingertips and the toes, and they give some electric stimulation, and the patients can feel some relief immediately. And if that's the case, then they can try to get it through your insurance, through medical supply stores, and you can do it at home on your own. So that's something topical and pretty much harmless, and it's worth trying. In terms of medications, there have been studies to help this problem, and there are 2 medications that are accepted as potential help, and one of them is called gabapentin. Gabapentin can be used in multiple different doses. A lot of times it can make you sleepy, so I like to use that only at bedtime, or small doses during the day and a little bit of a bigger dose at bedtime, and I see nice relief from that. The other one is called Cymbalta. You might have heard of Cymbalta. It's an antidepressant and has some other indications, but it was used in a small dose, half the normal dose in neuropathy, with a statistically significant benefit in those who had Cymbalta versus those who did not. So it is FDA approved for chemo-induced neuropathy, and sometimes we have to use all of this to get some relief. The good news is hopefully it's not a permanent problem. Hopefully it's temporary, but it can be at some degree lasting quite some time, up to months or years after completion of chemotherapy. And that's why we are quick in being on top of it by dose reduction and using all these tools to preventing it from getting worse.
Very helpful info. Thanks, Dr. T.